Hi everyone, it's Dave here. The last thing I was thinking I'd be doing today was making a video around a 76-page government policy, government document. But here I am doing it. It was brought to my attention earlier on today, a document called Preparing for a Challenging Winter 2020-2021. And I had a quick scan through it and it chilled my blood. Let's put it that way. Terrifying and disturbing language in there. So I thought, okay, I'm going to read the whole thing and really try and get a feel for what the government's got planned for us, to be honest with you. So it did. It took me about an hour and a half, and I've sketched out some notes. In fact, they're not notes. They are, I've written down verbatim extracts of the report, word for word. So there's no spin on this whatsoever. What I'm going to tell you about here is written there in black and white. You can go and have a look yourself. So, like I said, I wasn't planning on doing this today, but it kind of does fit in with it definitely does fit in with the theme of my social media, my Facebook and YouTube, The Imperfect Individual, because again, I've never seen such levels of compliance, of dumb conformity, and of fear around me at the moment. And I'm sorry, but I'm not falling for it. There's no way I'm falling for it. And I think it's important for me to try to tell you, bring to your attention what's out there in black and white that I would never have been aware of this actually until it was brought to my attention. So it's important to try to seek the truth, really, even if it's hard to find. Anyway, this is just a quick reminder again. Obviously, this document is focused on COVID-19, what's happened, where we are now, and what may happen, and what, like I said, the government's got planned for its citizens. And it's going to be a two-part video, this, and the really scary stuff is going to come tomorrow. But because I'm going to do two videos, because I don't want to do a really long video. So just a quick bit of context again, right from the very start. I know there's a whole debate around, the lockdown and how many lives did it save and how many lives did it cost. I think it's become increasingly clear that it's going to cost more lives than it saved, and that the way that the lockdown was carried out was exceptionally draconian, not just in the UK, and it had the unintended consequences of disproportionately affecting, killing the people that were most vulnerable, and the effect of the health service, 95% of the health service being decommissioned, basically unavailable. And the economy, obviously, 95% of the economy no longer functioning for best part of 9 weeks, and we're still definitely nowhere near back up to full capacity. This report also makes crystal clear that things like social distancing, the wearing of face masks is not a temporary measure, and that it's here to stay. And it explicitly uses the term, let me just see if I can find it. I've written it down somewhere. I can't find it. This will be tomorrow. I can't remember what it was. I'll come to it tomorrow, but it's something like preparing the public for the new normal. So anyone who thinks that we're going back to the old normal and that this is all going to be over in a matter of a few weeks, if you just do as you're told, just keep wearing them face masks, keep participating in the social distancing, keep doing the track and trace, just keep doing what you're told, it's all going to be over. No, it's not. I'm sorry to bring this to you. Right, anyway, so, and those, let me just quickly remind of the statistics where we are now. 45,752 people have died of coronavirus, or as we know, with coronavirus. We don't know how many people have died of coronavirus. Out of a population of 66 million, which is a total of 0.069% of the population. All very sad, of course, but any deaths are sad. And the figures, they can't be trusted, as Public Health England admitted a week last Friday that the figures are, that the way the deaths are being recorded there's been issues with it and that they're likely to be reduced. The figures that Public Health England, the NHS and the Office of National Statistics that they produce are all different. I don't think anybody's got any clue what's going on. And like I say, we still don't know how many people die of coronavirus or how many people have tested positive for it and have died of something else, getting hit by a bus 6 months later, still listed as a coronavirus death. All very murky, all very unclear. So I would take that 45,752 with a pinch of salt. It never did make sense that the UK had so many more deaths than other countries. But I don't want to go into too much into that, because everyone's got their own opinion on it, and this is not so much about me giving my opinion. This is just to bring your attention into the word for word excerpt of this government report that I think should bother and worry and be of grave concern to everybody. Now, the document reads almost like an admission that we've made a massive cock up here, everyone, and we're admitting it in this report, but we know no one's going to read it, so but it's there. I'm not going to tell you, but it is there. We made a massive mistake, and this is going to be the outcomes of the unintended consequences of this mistake, which we'll go into. And it's also there in black and white, and this is what we're going to do to take away even more of your freedoms. Which, me being cynical, doesn't surprise me because of like I say, the dumb compliance that I'm currently seeing in the general public at the moment. Anyway, right, it's called Preparing for a Challenging Winter 2020-2021. And the first thing it goes on to say was it looks back to the last winter where there was a spike in excess deaths, which was 2017-2018, which I think was due to a bad influenza season. England and Wales that year, just England and Wales, experienced approximately 50,000 excess winter deaths. Now, did we hear about this in the media? I mean, we probably did 1 or 2 days. I'm sure there was a story about it. Was there a 6-month-long campaign about it? Was there a government press conference every day for 3 months? Was there a mainstream media propaganda campaign? Was there mass fear? Was there an unleashing of moral vanity? One of those trends that is very, very commonplace now, unfortunately, in this country. Was there? Well, there wasn't, was there? So why this time? I wonder what the difference is. Interesting. Anyway, goes on to say, we estimate that the waiting list, the NHS waiting lists in England could increase from 4.2 million people pre-COVID to approx 10 million by the end of the year. By the end of this year, 10 million. That includes 3 million. This isn't in the report, by the way, this little bit. That does include 3 million cancer screenings that haven't taken place since March. 3 million cancer screenings. 10 million on a waiting list by the end of this year. God help us. Minimising community transmission and impact of coronavirus this winter. And just let me say, this is based yet again on a worst case scenario. I mean, do we never learn? Based yet again on a worst case scenario, this report. So, minimising community transmission and impact will include physical distancing and wearing face coverings in settings where physical distancing is not possible. So like I said earlier, those of you that believe that the social distancing and the face masks or face coverings, that those mandates are just in place for a few more weeks, and if we just do what we're told, it'll all go away and back to normal. No, it's in black and white here. Much more to come on that, probably tomorrow, in tomorrow's video. Where else are we? We'll be launching an extensive public information campaign in the autumn. So essentially, the brainwashing and indoctrination campaign is going to step up a gear. It's going to be even more intense in the autumn. God knows what that's going to entail. But that will only add to the fear, unfortunately, for those who have their eyes shut. The backlog of clinical care will be prioritised strictly by clinical need, not waiting time, which of course, in many degrees makes sense. Prioritise who needs to be seen medically. But basically what that is saying to you is if you've been waiting a long time already for routine medical care, maybe a hernia operation, a knee operation, I don't know, then get ready to wait for a hell of a lot longer. Improving health surveillance for COVID-19. Now, this word surveillance is littered throughout the report. Surveillance, it's on every single page, all about surveillance. Surveillance in the name of health. Any society that becomes this preoccupied with their health is a sick society. It really, really is. Especially one where the health is myopically concentrated on one condition that is exceptionally unlikely to do you any harm. Improving public health surveillance for COVID-19. This will entail maintaining a comprehensive, population-wide, near real-time, granular health surveillance system. I mean, it sounds like something out of Fidel Castro's Cuba, this, doesn't it? Physical distancing measures would likely be decided on more quickly than was possible during February and March 2020 due to this improved surveillance. There you go. There is a need for substantial surveillance, that word again, as schools reopen, to understand and track transmission. Even though all the evidence suggests that the transmission of COVID-19 between children and two children to adults is exceptionally low, virtually non-existent, yet still there's loads of kids that haven't gone back to school. For patients with chronic diseases, the suspension of elective services and routine outpatient appointments during the pandemic has increased the backlog of patients waiting to be seen. Well, of course it has, yeah. If you're going to shut down 95% of the NHS, well, of course that's going to happen. The risk is that a large number of patients will at best have poorer outcomes or at worst die unnecessarily due to delays in accessing care. Let me say that one again. The risk is that a large number of patients will at best have poorer outcomes or at worst die unnecessarily due to delays in accessing care. This is effectively the government admitting that they made a monstrous and huge mistake and that people are going to die as a result of it. And just to divert slightly there, what I would suggest is I think we're in for a long, hard winter with an NHS that is genuinely, this winter is going to be under incredible strain and will struggle to cope. I would suggest doing everything to boost your immune system, get as healthy as possible, because I wouldn't want to be going anywhere near a hospital in the next few months, to be honest with you. Anyway, where are we? There is already evidence of a delay in seeking medical attention in primary and secondary care for acute medical conditions due to patients' concerns regarding COVID-19, misplaced concerns, or a desire not to overburden the health service. Again, misplaced concerns. It was nowhere near to becoming overrun, the health service this year. Nowhere near. The suspension of screening programs and other routine surveillance programs may also lead to an increase in diseases presenting clinically this winter. According to NHS England, the number of urgent cancer referrals made by GPs dropped by 60%, 60% compared to 2019. Going to read it again. According to NHS England, the number of urgent cancer referrals made by GPs dropped by 60% compared to 2019, combined with 3 million cancer screenings that haven't taken place. I don't need to be a medical genius, and I am far from a medical genius. You don't need to be a medical genius. Nobody needs to be a medical genius to determine what the outcome is going to be of that. 3 million cancer screenings not taking place, 60% of GPs referrals, a reduction of 60% not taking place. It's obvious, isn't it, what the outcome of that is going to be? More admissions from the government here. Consideration also needs to be given to the potential wider physical and mental health implications of the lockdown, of the ridiculous lockdown, which has likely impacted on activity levels, calorie and alcohol intake, and mental well-being. Such factors may lead to a deconditioned and more vulnerable society. There is evidence that in the first month of lockdown, there was a surge in mental distress in the UK. I think we all saw that, didn't we? Preliminary evidence suggests that this is sustained. I would agree. The data suggests that the closures of nursery schools and universities may have significant population mental health distress in adults. Yes, well, logically that is playing out. well, logically it will play out, and it is playing out. I think you can see it all around us. More admissions here. Data from convenience samples indicate that there has been a significant increase in behaviour problems among primary school aged children with high levels of anxiety across all groups. Children have been let down terribly here, absolutely terribly. And not only have they been let down by not being able to go to school, by having to stay in bubbles, by not being able to see their friends for weeks on end, by not being able to interact and play as children do. Not only that, but the impact that this has had generally on their psychological well-being, and the example that I think that we as a society have set to the next generation is an atrociously bad one. We're scared, we have no resilience, we have no powers of perspective, and we've demonstrated that when a threat, which is, I would say, a mild threat really, comes along, we don't deal with it in a mature and resilient and comprehensive manner. That's how I see it. So God knows what psychological damage is being done to children at the moment. Where else? Actually, I'm going to leave it there because I'd say I'm about halfway through the notes. So we'll do more tomorrow. And like I say, the really scary stuff will come tomorrow when we see what the measures the government are wanting to put in place this winter and going forward, all in the name of stopping coronavirus, stopping the spread of coronavirus, except it's not, is it? Let's be honest, it's nothing to do with coronavirus anymore. It's something much more sinister. I hope more and more people are waking up now to this. And I can't remember whether I said this at the start about face masks. How unhygienic are these face masks, by the way? Can I just say, they're absolutely disgusting. An idea is so stupid, it's almost unbelievable. Anyway, if you believe in wearing face masks or face coverings, fair play, it's a free society. And this mandate from the government should not have been a mandate, it should have been advisory, in which case I wouldn't have had a problem with it. If someone wants to go out covering their face because it gives them psychological well-being, fair enough. Although, here's the problem when you make something compulsory. For some people, covering their face is psychologically damaging. What is one person's psychological well-being is another person's psychological hell. So for those of you out there, anybody watching this video, for those of you that believe in wearing face coverings and believe in the tranche of evidence that suggests that it does slow the spread of coronavirus, fair play, you carry on. Not a problem. It's a free world. Well, it's not a free world anymore, sorry. But you can make your own choice, that's fine. For those of you who don't believe it and believe the tranche of evidence that suggests it does nothing or has little to no effect, and potentially, and we may see this, that the unhygienic practices employed by many people will increase the spread of many diseases, yet you're still wearing one. Why? Why are you complying? Don't comply. Don't do it. Please don't do it. Anyway, I'm going to leave it there for the time being, and I will be back tomorrow with the second load of notes that I've written down. Like I say, it's all word for word this. I'm not spinning anything at all. It's all there in black and white for you to see, and the really scary stuff as well. So, yeah. Okay. Speak to you tomorrow. Bye-bye.